The idea of healthy knees sounds more and more foreign as you get older, but it's not normal to lose knee function. It's common, but it's not normal. Most children today have full range of motion of their knees when they're at a very young age. And you see that and go, how did I lose that? And how do I get it back? Let's get into it. This is what healthy knees should look like. Full range of motion, pain-free, fully comfortable. Something I always stand by is movement is medicine. Muscles, joints, ligaments, anything. Movement is always medicine. So to move the joints, full range of motion is always critical. Obviously going from an awful pair of knees to this is a massive step up. But how do you get there step by step? Firstly, find some sort of elevated surface, probably around knee height. Area is pretty good. So to start with, having the affected knee up on this elevated surface, literally just move the joint for a bit. Not full range of motion, just partial range of motion. But even this is still beneficial, okay? It may not be full range of motion, it's still moving the joint, which is always beneficial. From here, what you can do is actually go into it and hold, okay? So find a position where you can go into it relatively pain-free, okay? And just hold it there. A bit of tenderness is probably expected and it's okay. Just get to that point and just hold it there, yep. And then bring yourself out of it. Do that a few times. Just bear in mind too, I'm not saying go and do this overnight, okay? Make sure you do it step by step. Have a few days in between. Stay on one step for say a few days or a week. All I'm saying is don't rush it. Knees take time. The knee joint can be so niggly, so painful, and just so frustrating. Take it day by day and take it step by step. As you get that knee joint to be more comfortable in more deep positions, you can really lengthen out if you want, okay? There we go. The reason for the elevated surface is to not have gravity affecting the knee, okay? This takes gravity out of the equation. Now what you can do is lower that surface. Start here and move down, okay? Start here, then hold it there. Once you master that first surface, and now that second surface, you can then integrate some light dumbbells in it too. These are 2 kilo dumbbells, okay? What you can do now is just, same thing, edge into it and bring it up. Edge into it, bring it up. The dumbbells are a great way to have controlled weight and really slow progression into building up that knee joint with full range of motion. So after that, once you've finally built up a little bit of strength and range of motion, what you can do is go to the floor now. This is different because now you have more gravity playing into the equation as well. So what you can do is, again, even just have one knee on the ground. So have your supporting knee on the ground. That way that takes the gravity. That way this one's still quite light and no pressure on it really. You can still edge into it, okay? You still feel the gravity coming onto it now. It's still beneficial because you can still progress into it and not rush into it. So yes, we're on ground level, but you can still just even support yourself here if you need to, okay? The final part to this one is to actually take this supporting knee off the ground and putting load onto this knee. Now, this takes time, it takes patience, okay? It may feel very tender, but just don't push through it if it feels too painful, okay? This is like the last step to that full knee range of motion. So if you don't feel ready for it, don't push through it. Just do it step by step and very gradually. From there, you can add dumbbells to increase the load, but that's basically the full knee range of motion. If you can do that, you got healthy knees.